Hey everyone, today we're discussing silent heart attacks. These heart attacks don't announce themselves with sirens blaring. They might feel like heartburn, fatigue, or just feeling off. Ignoring these signs can have serious consequences. We'll break down the top warning signs you shouldn't ignore. Knowledge is power. Understanding these signs could save your life. Stick around. This is information you don't want to miss. Let's kick things off with a symptom that's often brushed off as just being tired, unusual fatigue. We all experience fatigue, especially in our busy lives. But this is a fatigue that's persistent, unexplained, and different from usual exhaustion. It can be a sign your heart isn't pumping blood efficiently. When your heart works harder, it leaves you feeling drained. Fatigue can be caused by many things, but unusual, persistent fatigue should be checked by a healthcare professional. Your body communicates with you. Listen to it and seek medical attention if needed. How do you know if your fatigue is something to be concerned about? Look out for a few key things. Is this fatigue new or unusual for you? Is the fatigue persistent? If you're constantly feeling drained, see a doctor. Is the fatigue accompanied by other symptoms? It could be a sign of a serious problem. Don't hesitate to talk to your doctor. Let's move on to another common yet often overlooked warning sign of a silent heart attack: shortness of breath. We all get out of breath from time to time, especially after a workout or climbing stairs. But shortness of breath as a heart issue is different. It might feel like you're gasping for air, even at rest. You might find it difficult to catch your breath. This can be incredibly frightening. Your heart pumps oxygen-rich blood throughout your body. When your heart isn't functioning properly, it can't pump blood efficiently. This can lead to fluid buildup in your lungs. This is called pulmonary edema, often a sign of heart failure. If you experience sudden shortness of breath, call 911 immediately. Now, it's important to remember that not all shortness of breath is caused by a heart problem. It can also be a symptom of other conditions like asthma, pneumonia, or even a panic attack. However, it's crucial to be able to differentiate between these conditions and a potential heart issue. Here's a good rule of thumb. If your shortness of breath comes on suddenly, is severe, or is accompanied by chest pain, sweating, nausea, or pain in your jaw, neck, or back, seek immediate medical attention. These are all red flags that should never be ignored. On the other hand, if your shortness of breath is mild, comes on gradually, and is related to a known condition like asthma, it's probably not a heart attack. However, it's still important to monitor your symptoms and see your doctor if they worsen or don't improve with treatment. Remember, when it comes to your heart health, it's always better to be safe than sorry. Don't hesitate to seek medical attention if you have any concerns about your breathing. We've all experienced indigestion at some point, right? That burning sensation, maybe some bloating after a big meal. But sometimes those feelings could be a sign of something more serious, like a silent heart attack. The nerves in our chest and abdomen are closely interconnected. Heart distress can send pain signals that feel like stomach pain. Persistent or unusual indigestion? Get it checked by a medical professional. Let's be clear. I'm not saying that every time you feel a little heartburn, you should rush to the emergency room. But there are some red flags to watch out for. If your indigestion is severe, comes on suddenly, or feels different from your usual indigestion, those are signs that it's time to seek medical attention. Additionally, if you experience indigestion alongside other symptoms like chest pain, shortness of breath, sweating, or pain radiating down your arm, it's crucial to call 911 immediately. These could be classic signs of a heart attack, and time is of the essence. Remember, it's always better to err on the side of caution when it comes to your health. Don't hesitate to call your doctor or seek emergency medical attention if you're experiencing any unusual or concerning symptoms, even if you think it might be just indigestion. Your health is your most valuable asset, so listen to your body and take action when it's trying to tell you something. Early detection and treatment can make all the difference. When we think of heart attack symptoms, we often picture that classic Hollywood image of someone clutching their chest in agony. But in reality, heart attacks can manifest in much more subtle ways. One sneaky symptom is pain in the jaw, neck, or back. The nerves that supply your heart and those areas are interconnected, so pain signals can get mixed up during a heart attack. Your brain might interpret them as coming from your jaw, neck, or back. Not all jaw, neck, or back pain is a sign of a heart attack. One important factor is the presence of other symptoms. If you have chest pain, shortness of breath, nausea, sweating, or dizziness, seek medical attention immediately. Heart-related pain often radiates or spreads. Always consult with a medical professional for unusual or concerning pain. We all sweat, right? It's our body's natural way of regulating temperature, especially during exercise or hot weather. But did you know that excessive sweating, even without physical exertion, can sometimes be a warning sign of a silent heart attack? Now I know what you're thinking. Dr. Mike, isn't sweating just a normal bodily function? And you're absolutely right, but when your heart is under stress, like during a heart attack, it can trigger your body's fight or flight response. This response releases a surge of adrenaline, which, among other things, can cause you to break out in a cold sweat. You might feel clammy, your skin might feel damp, or you might even notice beads of sweat dripping down your face or body. The key here is to pay attention to the context. If you're sweating excessively and it's not related to physical activity, hot weather, or a fever, it's worth taking note of, especially if it's accompanied by other symptoms like chest pain, shortness of breath, or nausea. So, how much sweating is too much? Well, it's important to remember that everyone is different. Some people naturally sweat more than others. The key is to pay attention to any changes in your own sweating patterns. If you're suddenly sweating more than usual, or if you're experiencing night sweats that soak through your clothes or bedding, those are things to discuss with your doctor. They can help you determine if your sweating is related to an underlying medical condition, like a heart problem. Remember, our bodies are constantly communicating with us, and sweating is just one way they try to get our attention. By paying attention to our bodies and seeking medical attention when necessary, we can help ensure our hearts stay healthy and strong. Don't ignore the signs. Early detection and treatment can make all the difference. Alright, let's talk about dizziness or lightheadedness. We've all felt it, that woozy sensation like the room is spinning. Maybe you stood up too fast or skipped a meal, that's usually harmless. But when dizziness comes on suddenly, or persists without a clear reason, it's a red flag. Why? Because your heart might not be pumping blood effectively. See, your brain needs a constant supply of oxygen-rich blood to function properly. If your heart isn't pumping efficiently, like during a silent heart attack, blood flow to the brain can be reduced. That's when you might feel dizzy, lightheaded, or even faint. Now, I'm not saying every time you feel dizzy it's a heart attack. There are many other causes like dehydration, inner ear problems, or even certain medications. But if you're experiencing sudden or unexplained dizziness, especially alongside other symptoms we've discussed, don't brush it off. Get it checked out by a doctor. Remember, early detection is key when it comes to heart health. It's always better to err on the side of caution. So, how do you know when dizziness is serious enough to warrant medical attention? Well, pay attention to the context. Is the dizziness severe? Does it come on suddenly, or last for an extended period? Is it accompanied by other symptoms like chest pain, shortness of breath, or nausea? If you answer yes to any of these questions, don't hesitate. Call 911 or head to the nearest emergency room immediately. It's always better to be safe than sorry. Remember, time is of the essence when it comes to heart attacks. On the other hand, if the dizziness is mild, infrequent, and not associated with other concerning symptoms, you can schedule an appointment with your primary care physician. They can assess your overall health, review your medical history, and determine the underlying cause of your dizziness. The bottom line is this: listen to your body. You know yourself best. If something feels off, don't ignore it. Seek medical advice and get the reassurance you need. Let's talk about swelling in your legs, ankles, or feet. Some swelling after standing or in hot weather is normal. Persistent or unexplained swelling could indicate a heart issue. Your heart pumps blood throughout your body. In heart failure, it can't pump blood efficiently. This causes fluid buildup, especially in your legs. This swelling, called edema, can be heavy, tight, or painful. Shoes may feel tighter and skin may indent when pressed. If you notice unexplained swelling, consult your doctor. Early detection and treatment of heart problems can make a world of difference. So, how can you tell if your leg swelling is something to be concerned about? Pay attention to the accompanying symptoms. Are you also experiencing shortness of breath, especially when lying down? Do you have unexplained fatigue or weakness? Are you noticing any changes in your urine output, like decreased frequency or volume? If you answered yes to any of these questions, it's essential to seek medical attention promptly. Your doctor can perform a physical exam, review your medical history, and order tests to determine the underlying cause of your swelling. Remember, taking care of your heart health is crucial. Don't ignore your body's warning signs. By being proactive and seeking medical advice when needed, you can take charge of your health and well-being. Let's dive into the fascinating world of heart rhythms, specifically irregular heartbeats. Your heart has its own electrical system that controls the rhythm of your heartbeat. A normal, healthy heartbeat feels steady and regular, like a rhythmic drumbeat. However, sometimes this rhythm can become irregular, leading to sensations like fluttering, pounding, racing, or skipped beats. These irregularities, known as arrhythmias, can be harmless and temporary, often caused by stress, caffeine, or certain medications. But sometimes an irregular heartbeat can signal a more serious underlying heart condition, including a silent heart attack. During a heart attack, the heart muscle is deprived of oxygen, which can disrupt the electrical signals that control your heartbeat. Now, it's important to remember that not all irregular heartbeats are cause for alarm. However, if you experience persistent or worrisome palpitations, especially if they're accompanied by other symptoms like chest pain, shortness of breath, dizziness, or fainting, it's crucial to seek medical attention immediately. So, how do you know when an irregular heartbeat is something to worry about? Well, there are a few key things to consider. First, how often do you experience these irregular heartbeats? Are they a one-time occurrence, or do they happen frequently? Second, how long do the irregular heartbeats last? Do they disappear quickly, or do they linger for an extended period? Finally, are the palpitations accompanied by other concerning symptoms, such as chest pain, shortness of breath, dizziness, or fainting? If you experience frequent, persistent, or prolonged irregular heartbeats, especially if they're accompanied by other symptoms, don't hesitate to seek medical attention. Your doctor can perform an electrocardiogram, ECG, to monitor your heart rhythm and identify any abnormalities. Remember, early detection and treatment of heart conditions are crucial for maintaining optimal heart health. So listen to your body and don't ignore any unusual or concerning symptoms. We all know how important a good night's sleep is for our health. Difficulty sleeping can sometimes be a warning sign of heart trouble. Your heart health and sleep quality are closely intertwined. When your heart isn't functioning optimally, it can disrupt your sleep. You might wake up gasping for air. This is known as paroxysmal nocturnal dyspnea. Insomnia can also indicate a heart issue. Feeling anxious or restless at night could be a sign. Consult your doctor if you have persistent sleep problems. Now let's talk about sleep apnea, a condition where your breathing repeatedly stops and starts during sleep. It's often characterized by loud snoring and gasping for air. Sleep apnea is more than just a noisy nuisance. It's a serious sleep disorder that can significantly impact your heart health. During an apnea episode, your body is deprived of oxygen, putting extra strain on your cardiovascular system. This can lead to high blood pressure, an irregular heartbeat, and even increase your risk of heart attack and stroke in the long run. If you suspect you might have sleep apnea, it's essential to talk to your doctor about getting a sleep study done. This will help determine the severity of your condition and the best course of treatment. Treating sleep apnea is crucial for protecting your heart health. Your doctor might recommend lifestyle changes, such as losing weight, quitting smoking, and avoiding alcohol before bed. In some cases, they may also recommend using a continuous positive airway pressure, or CPAP, machine to keep your airways open while you sleep. We all experience anxiety from time to time. It's a normal human emotion, but when anxiety strikes out of the blue, it can be unnerving. Many factors can trigger anxiety. Sometimes it's a warning sign of a heart attack, especially in women. When your heart isn't getting enough oxygen-rich blood, it can trigger a fight or flight response. This can manifest as sudden, intense anxiety. Not all anxiety is related to heart health, but if you have sudden anxiety with chest pain or shortness of breath, seek medical attention immediately. Time is muscle with heart attacks. Call 911 if you suspect a heart attack. Let's delve a bit deeper into panic attacks. A panic attack is a sudden episode of intense fear that triggers severe physical reactions when there is no real danger or apparent cause. These attacks can be terrifying and often mimic the symptoms of a heart attack, making it even more crucial to understand the difference. During a panic attack, you might experience a racing heart, chest pain, dizziness, shortness of breath, sweating, and trembling. These symptoms are caused by the body's stress response kicking into overdrive. While panic attacks themselves don't directly damage the heart, they can be incredibly frightening and lead to seeking emergency medical attention, which is a good thing. It's always better to err on the side of caution when it comes to your heart health. If you frequently experience panic attacks, it's essential to talk to your doctor. They can help determine if there's an underlying medical condition contributing to your anxiety and recommend the most effective treatment options, such as therapy, lifestyle changes, or medication. So there you have it, guys, the top 10 warning signs of a silent heart attack you should never ignore. Remember, these symptoms can be subtle and easily mistaken for other less serious conditions. But by being aware of them and listening to your body, you can take proactive steps to protect your heart health. If you experience any of these symptoms, especially if they are persistent or worsen over time, don't hesitate to seek medical attention. Early detection and treatment are crucial for improving outcomes and living a long, healthy life. Don't forget to subscribe to our channel for more health tips and information. Stay healthy and stay informed.